The question of euthanasia, or physician-assisted suicide, is not a new one. Euthanasia is defined as intentionally administering medications or other interventions to cause the patient's death with the patient's informed consent, and physician-assisted suicide is when a physician provides medications or other interventions to a patient with the understanding that the patient can use them to commit suicide. Regardless of the small differences in these two definitions, the point is that there exists a contentious dispute about the ability to end one's life in a medical setting. Recently, in February 2022, the controversy surrounding euthanasia was brought to light again when a bill on end-of-life options failed to move forward in Utah. The bill was meant to allow doctors to prescribe a terminally ill patient life-ending medication. It failed to pass the committee on a 2-9 vote. However, the question still remains: to what extent should euthanasia be allowed? The ethics surrounding euthanasia have been a controversial issue since the beginning of medicine, and support for euthanasia has repeatedly waxed and waned. In the 17th century, common law in the American colonies prohibited both suicide and assisted suicide. This remained the norm in America throughout the 18th century, when the Great Awakening prevented both secularists and agnostics from giving rise to popular support of suicide. American evangelical Christians in particular firmly rejected suicide and euthanasia. In fact, we still see the same patterns of opposition today. Surveys indicate that those who are religious are much less likely to support euthanasia compared to those who aren't. Going back to the late 1800s, we see the first notable voices supporting euthanasia beginning to form. In 1870, Samuel Williams argued in favor of euthanasia in front of the Birmingham Speculative Club, and his speech ignited debate about legalizing euthanasia among both British and American physicians alike. The tide began to change in favor of euthanasia in the late 1900s. Public support for euthanasia began to increase, and by 1977, more than half of the American public supported physician-assisted suicide. While the majority of the American public is willing to support euthanasia, support is much lower among physicians, with less than half of American physicians supporting euthanasia. A notable exception is Jack Kevorkian. In the 1990s, Kevorkian, a pathologist, put public support for euthanasia to the test when he gained international attention for his assistance in the suicides of over 100 patients. He famously earned the nickname Dr. Death. While ethicists criticize Kevorkian for assisting in the deaths of virtual strangers and seeking publicity in order to promote his own ideas, Kevorkian claimed that he had never cared about anything but the well-being of his patient, and that most American doctors failed their patients by not responding to their suffering. He famously said, "I'm trying to knock the medical profession into accepting their responsibilities, and those responsibilities include assisting their patients with death." Kevorkian was a keystone figure in the euthanasia movement and made great progress, and he later declared he would no longer assist patients but would redirect his efforts toward changing the laws surrounding euthanasia. At the same time, laws around euthanasia were already beginning to change. On November 5, 1990, the Supreme Court passed the Patient Self-Determination Act. Taking effect in 1991, this act required hospitals that receive federal funds to inform patients that they have a right to demand or refuse treatment. Although euthanasia and physician-assisted suicide were still technically illegal under this act, it allowed a patient, if they chose to do so, to abstain from treatment and die. The Patient Self-Determination Act was a huge step in expanding patients' rights. However, concerns from physicians revolved around being accused of assisting suicide and of malpractice liability if difficulty arose in implementing patient wishes for any reason. Following the Patient Self-Determination Act came the Oregon Death with Dignity Act in 1994. As one of the most important legal changes in favor of the euthanasia movement, the Oregon Death with Dignity Act allowed terminally ill patients to legally request and obtain medication from a physician to achieve a humane and dignified death. This act became the first law in U.S. history to permit physician-assisted suicide. The passage of this act drastically changed the debate over euthanasia. The question, which used to be centered around whether assisted suicide should ever be legalized, transformed into one about how this new initiative will be carried out and whether other states will follow Oregon's leading example. This new question was answered 14 years later in 2008, when Washington passed their own Death with Dignity Act, becoming the second state to legalize euthanasia. Similar to Oregon's Death with Dignity Act, this act allowed terminally ill patients seeking to end their life to request lethal doses of medication from physicians. The passage of this act only demonstrates how more and more states are beginning to pass laws in favor of euthanasia. As of 2022, 10 states have legalized physician-assisted suicide. Those include Oregon, Washington, California, New Mexico, Colorado, Montana, Hawaii, New Jersey, Vermont, and Maine. The euthanasia movement is still going strong, and one of the biggest supporters for the right to die is the Death with Dignity National Center. As of 2022, they have several ongoing campaigns. These include getting states to drop the residency requirements for death with dignity, passing a Death with Dignity Act in Massachusetts, and supporting euthanasia legislation in New York. While a select group of people like Catholics, anti-abortion advocates, and some disability groups continue to oppose assisted suicide, polls show widespread support for euthanasia. A survey conducted in 2020 found that 74% of respondents agreed that physicians should be permitted to end a patient's life by some painless means should a patient request it. It's clear that support for euthanasia is growing and will only continue to do so in the future, and the question of euthanasia is no longer if it should be widely permitted, but when it will be widely permitted.